Caledon.
Thank you, Speaker. My question is to the Minister of Health and Long-Term Care. My constituent, Lorie Leckie, contacted me after her daughter, Jamie Lee, was forced to wait in a hallway for 5 days because there was no hospital bed for her at Brampton Civic. From the Brampton Guardian, Lorie's daughter said, quote, "I spent 5 days in a hospital, afraid, in pain, and staring at a white partition wall as I anxiously awaited answers." Lorie wants you to explain why her daughter had no hospital bed for 5 days.
Thank you. Minister of Health, Long-Term Care.
Well, thank you, Mr. Speaker. And I have to say that I was distraught when I learned of this particular individual and in a very vulnerable state in what she had to endure at one of our hospitals, Mr. Speaker. And it's important that all of us that have a role to play in providing that highest quality care remember specifically that we're dealing with individuals in an extremely vulnerable state, and we need to do everything we can to ensure their safety, that they're taken care of in a compassionate way. And Mr. Speaker, I, as a result of that, am looking very carefully and specifically in terms of measures that we can and should take that hopefully this situation doesn't happen.
Supplementary.
Minister, I'm sure that Lorie and Jamie Lee appreciate your sympathy, but you are the Minister of Health. You have an opportunity to fix this issue. It's not new. We just heard about it in Hamilton. It's happening in Brampton. It's happening all over Ontario. Please do something. It's unfair to people like Jamie Lee. It's an example of hallway medicine. No privacy, no beds, just another justification. There is no way it's acceptable that someone has to lay in a hallway for 5 days without a bed in the province of Ontario. When will the minister ensure that our loved ones get a bed when they need one?
Well, Mr. Speaker, and I was asked this question yesterday by the media, and I was asked at the brand new Peel Memorial Health and Wellness Centre that the Premier and I opened yesterday, which has a vast array of services available to individuals of the Brampton and neighbouring communities, including an urgent care centre, which is drawing away some of the patients that previously would have gone to Brampton Civic, which is the hospital that the the member opposite referenced. It has dietitians, chiropractors, day surgery, cataract surgery, dialysis, many services in this brand new facility, which has been so well received and appreciated by the community. And it's measures like that, Mr. Speaker, which will draw individuals in the community to the appropriate resource and reduce the overcrowding that the member opposite mentioned.
Thank you.